Have you noticed how so many young people are dying of heart attacks? I know I've spoken about this in the past and repeatedly, but there's a need to talk more about this and try and understand why heart attacks are suddenly claiming young lives. They said there are 6 things that make a person vulnerable to heart attacks.
When we think of a heart attack, we imagine a dramatic moment, clutching the chest, falling to the ground, a rush to the emergency room. But what if your heart was crying for help and you didn't even hear it? Every year in the US, around 170,000 people suffer what's known as a silent heart attack, a cardiac event with symptoms so subtle they often go unnoticed. Many survive, but they're left with permanent heart damage because they didn't realize what was happening. In today's video, we're diving deep into the top 10 warning signs of a silent heart attack that you should never ignore. Your body often whispers before it screams. Are you listening? 1. Mysterious pain in the jaw, neck, or upper back. You might think heart attacks only cause chest pain, but your body has a strange way of warning you. If you suddenly feel tightness or aching in your jaw, neck, or upper back, and it's not due to posture or injury, it could be your heart sending distress signals. Why? Because pain from the heart can radiate to these areas due to shared nerve pathways. This kind of discomfort is often brushed off as muscle tension, but for many, it was the only clue before a silent heart attack changed everything. 2. Crushing fatigue that won't go away. Ever feel like you're dragging yourself through the day, even after a full night's sleep? Unexplained fatigue, the kind that hits like a wave and doesn't let up, was reported by 70% of women before their heart attacks, according to the American Heart Association. Your heart is struggling to pump blood. Oxygen isn't reaching your muscles and brain the way it should, and your body is screaming for rest. Don't just chalk it up to stress or age. This could be your warning. 3. That elephant on your chest pressure. It's not always sharp pain. Sometimes it feels like a tight squeeze, a band wrapping around your chest, or a heaviness like an elephant sitting on you. This is called angina, and it's your heart not getting enough oxygen. Even if the feeling comes and goes or feels more like discomfort than pain, don't ignore it. It could be the calm before the storm. 4. Sudden, unexplained sweating. You're sitting in a cool room, not stressed, not active, and suddenly you break into a cold sweat. This isn't your body cooling you down. It's your heart going into overdrive, pumping harder through blocked arteries. If you're drenched with no reason, and it's paired with other symptoms like nausea or dizziness, call for help immediately. Your heart may be fighting silently. 5. Nausea, bloating, or a lost appetite. Feeling full after a small meal, or nauseous without any stomach bug. During a silent heart attack, blood is redirected away from the digestive system to protect vital organs. That's why some people feel bloated or nauseated, even if they haven't eaten. If these symptoms appear without an obvious cause, especially alongside fatigue or chest discomfort, get checked. Midway transition. We're halfway through the list, but remember, any one of these symptoms could be your heart's subtle cry for help. If you haven't already, hit that subscribe button and turn on notifications because your health is worth it. Let's keep going. 6. Lightheadedness or sudden dizziness. When the world spins without warning. Have you ever stood up and felt like the floor shifted beneath your feet? Or maybe the room started spinning while you were just sitting quietly? That sudden lightheadedness or dizzy spell might feel harmless, but it could be your heart waving a red flag. Here's why. During a silent heart attack, your heart struggles to maintain steady blood flow. As blood flow slows, especially to the brain, you may begin to feel faint, disoriented, or even close to blacking out. This isn't just about low blood sugar or missing a meal. This is your brain not getting enough oxygen. What makes it dangerous is that people often brush it off as dehydration, fatigue, or anxiety. But if this dizziness comes suddenly, without warning, or is accompanied by blurred vision, weakness, or nausea, it could be an early sign of a cardiovascular event. Some silent heart attack survivors have reported feeling dizzy for days or even weeks before their event. They assumed it was stress. Don't make the same mistake. If it keeps happening, go see your doctor. It's better to catch a heart issue early than regret it later. 7. Difficulty breathing. The silent gasp for air. Breathing is automatic until it isn't. One of the most alarming and often overlooked signs of a silent heart attack is shortness of breath, or what doctors call dyspnea. You might feel like you're not getting enough air, even though you're breathing. Your lungs feel tight. You try to take a deep breath, but it doesn't satisfy. This happens because when the heart isn't pumping effectively, especially the left ventricle, which sends oxygen-rich blood throughout your body. Your lungs can become congested with fluid. That makes every breath feel harder. It can feel like you're suffocating from the inside out. And here's the twist. It might not come with chest pain. Some people only notice it when lying down or doing light activities like walking or climbing stairs. You may wake up in the night gasping for air, or find yourself breathing rapidly, trying to catch your breath after simple movements. Many women especially report breathlessness as their only symptom during a heart attack. If you're breathing heavily without exertion, or your breathing has changed in the last few weeks or days, your heart could be in trouble. Don't wait. Seek help immediately. 8. Swelling in the legs, ankles, or belly swelling, also known as edema, can be a silent yet visible sign that your heart isn't working right. When the heart can't pump properly, blood pools in the lower body and fluid builds up. Legs and ankles puff up. Even your stomach can swell. And here's the scary part. Many people ignore this as weight gain or tired feet. But 20% of silent heart attack patients showed signs of swelling. 9. Persistent flu that just won't go away. If you have lingering flu-like symptoms, body aches, fatigue, mild fever, but no real infection, your immune system might be reacting to something deeper. In fact, a 2018 study revealed that a flu infection increases your heart attack risk 6-fold in the first 7 days. Even if the flu didn't cause the heart attack, it can expose underlying heart problems. So, if your flu symptoms linger and come with chest pressure, shortness of breath, or dizziness, don't ignore it. You could be on the edge of something worse. 10. Trouble sleeping. Your heart may be keeping you awake. We all have sleepless nights once in a while. But when insomnia becomes persistent, especially when paired with strange restlessness or anxiety, it might be more than stress. It could be your heart quietly warning you. Research has shown a strong connection between poor sleep and heart disease. And before a silent heart attack, your body may respond to internal distress by releasing stress hormones like adrenaline and cortisol. These chemicals put your body in a state of alert, making restful sleep nearly impossible. You may experience frequent waking during the night, or a general feeling of being on edge with racing thoughts or a pounding heart, even if you're lying still. Some even report waking up gasping for air, or feeling like something is wrong without knowing why. It's not just psychological, it's biological. Your nervous system is reacting to the stress of reduced blood flow. Your heart's struggle may show up in your sleep long before any physical symptoms hit. So, if you're spending night after night tossing, turning, or waking in a panic, and you can't blame it on coffee, stress, or noise, get your heart checked. Because sometimes the reason you can't sleep is because your heart won't let you. A silent heart attack doesn't scream, it whispers, but the damage it causes can be just as deadly. Your body is brilliant. It sends clues when something's off. Don't ignore these signs. Don't wait for the dramatic moment. If something doesn't feel right, speak up, see your doctor, and get tested. Remember, you don't need chest pain to be in danger. Small actions like paying attention, eating well, staying active, and avoiding smoking can literally save your life. If this video helped you, drop a comment, like, and share it with someone you care about. And of course, don't forget to subscribe for more powerful health breakdowns. Stay safe, stay healthy, and always listen to your heart.